Hello, everyone. John Benko, the Director of Nursing here at Belfair. It is May the 5th, Cinco de Mayo. If you celebrate that, happy Cinco de Mayo. I celebrated earlier this morning by taking my temperature. It was 98.0. Happy to report I don't have a fever. I have no other symptoms. And so here I am on campus. I say those things because I want to remind you that if you're not feeling well, if you're sick for any reason, and certainly if you have a temperature above 100 degrees Fahrenheit, you need to follow your call-off protocol and do not come to work. We'll remind all of our health screeners out there to make sure that you're making sure your fellow employees are meeting the screening requirements, they're taking their temperature, and they're answering those questions so we know that they have been healthy and well and they are happy to be here and returned to work in good order. We do take the temperature of all of our residents here on campus twice a day. We monitor their health. We make sure they have no signs or symptoms of COVID-19 or any other communicable illness. And at this recording this afternoon, none of our residents on campus have any of those symptoms. So we're happy about that. Speaking of symptoms, if you are homesick, so you've taken ill, you've had a temperature above 100 degrees Fahrenheit or some other symptoms, before you can return to work, you need to make sure you are fever-free for 72 hours without the aid of an antipyretic medication. So you're home, you're not feeling well, you have a fever, you're taking care of yourself, you're starting to feel better, you no longer have a fever. 72 hours after that fever has dissipated without the assistance of an antipyretic like Tylenol or Motrin, you can safely return to work. If you have questions, if you've been off for a couple of days, you want to ask your supervisor, check in with your divisional leadership, find out if it's appropriate for you to come to work. Generally speaking, if you've been sick for a number of days, it's a great idea to reach out to your primary health provider and see if you can get some support in that way. Basically, I bring these things up because we want to make sure no one's coming to the campus with any symptoms. We don't want anyone sick being here. We're trying to mitigate the communication of COVID-19, of course, and certainly any other disease that might be out there. So please help us with that. One of the ways that we're following the guidelines to make sure that we all stay COVID-19 free is using masks, cloth masks, just like you have to wear anytime you leave your home. You go into a store, the gas station, stopping somewhere. Certainly if you're going to see a medical provider, you're going to be wearing some sort of a mask. We're asking you to use those masks here on campus as well. The agency has gone to great lengths to make sure that masks are available. Everyone should have received one. If you have not, please check with your supervisor, and divisional leadership will make sure that you get a cloth mask. Of course, with any good piece of equipment, masks need to be taken care of. There's do's and don'ts. Of course, you want to wear it snug across your mouth and nose. You want to make sure it's clean and dry. So wash those masks, make sure they're dry, and use them in good order. Speaking of making sure that we're preventing everything we can prevent, your hands can be deadly, right? You need to wash your hands. Please keep up the hand hygiene. There is sanitizer throughout the area in the workspaces. If you don't have any, again, get through to your leadership, your immediate supervisor. They can get with facilities. I think it's Antonio on the east side and Lynn on the west side. We send them an email, let them know what we need. They'll get it to us. You also want to make sure you have sanitizing products, right? In addition to good hand hygiene, we want to sanitize our workspace. Saw a good discussion with a very brilliant doctor, a radiologist out of Stanford University, discussing all the things that we're doing to protect ourselves. Physical distancing, staying 6 feet away, good science behind that whenever that's possible. When it's not, we want to be using those cloth masks, so in case we were to sneeze or cough, or somehow otherwise project any of our secretions out of our head, we don't want them going to someone else. We want to stop touching our face. Unfortunately, some of her metadata has shown that when we wear a mask, we touch our face a lot. We have to stop doing that. We don't want to touch our eyes, nose, mouth. We don't want to get any virus we may have come in contact with into our mucosa. That would be bad. So we're going to wash our hands. We're going to sanitize. Again, wipes available through facilities. Go through your leadership. They can reach out to the people I've mentioned. Studies have shown that when the people in the workspace take some ownership of that, wiping it down. They take care of their flat spaces, their doorknobs, their light switches, their computers, their phones. We see at least an 85% drop in the viral load in that room. If we add good hygiene, it gets much higher. Hygiene, by hand hygiene, I mean you're washing your hands for 20 seconds with soap and water, or you're using sanitizing hand wash. Again, all those things are available to you. We want to make sure you have them. So please do what you can to help us control the spread of this virus. We know that Ohio is opening more and more places. We know as the time goes on, more and more places still will be open. So you'll be in contact when you go home or leave campus with many more people. We want to make sure that you're wearing your mask. I have my mask, right? It's not on right now because I'm in a room that's closed. I'm by myself. But if I were to be out anywhere by other people, I would don my mask. Please make sure you do that. Wash your hands. Wash them a lot. Use those sanitizing wipes. Just keep good order on sanitation. Watch what you touch. We don't want to bring, certainly don't want to bring the disease home to our families, and we certainly don't want to bring it here on campus if we can at all prevent it. So do what you can. I'm just going to remind you that we want to wear a mask, wash our hands, keep up that physical distancing when we can. Hey, acknowledge that times are different, right? Things are different now than they used to be. That's going to be stressful. Mitigate your stress. Do what you can, right? Take a couple seconds every day. Take a deep breath. Relax yourself. Drop those shoulders. Yes, this is hard. We know that. But we're going to get through it. We'll get through it together. If you need help, ask for help. We have an employee assistance program. Call HR. Talk to your immediate supervisor. Email me at bankoj@wingspancg.org. We'll get you the contact information so that you can get the help that you need. We need to stay healthy. One way to do that is being kind. When you're kind, you're happy. When you're happy, your immune system works. So let's spread kindness and not virus. That's it for today. Reminding you all, if you're not feeling well, go home. Don't be here. If you have any questions, if I can help you, send me an email. In the meantime, hey, look after each other, be kind, wash your hands, and stop touching each other. Bye.